All right, for all the isolation that we've all keep enduring, all the economic pain, the fact is the worst might yet to come. Today, the Premier of Ontario, as you just saw, Doug Ford, said he'll reveal what Ontario is expecting. He said it will be stark and sobering. So why won't the Prime Minister release the federal basic data on what to expect? And is there more help for provinces hard hit by the coronavirus? Let's find out. There'll be a phone call tonight, but right now, the Minister of Economic Development and Official Languages, Melanie Joly, joins us. Great to have you on the program. Pardon me, Minister, great to have you here, and I hope you and your loved ones are safe in this crisis. Repeated calls for the federal government to release the modelling data. Ontario is going to do it tomorrow. BC's done it. I don't really, frankly, understand the rationale. Why won't the federal government just tell us what they're expecting?
Well, you and I, everybody watching us knows that healthcare systems are dealt at the provincial level. And therefore, the data always comes from the provinces and territories. We can work on many models, but at the end of the day, we need to work with provinces and territories to help them, to support their own needs. And that's what we've been doing for the last 3 months. And of course, this is a conversation the Prime Minister will be having with Premier Ford, with Premier Legault, and with all the premiers across the country as we're dealing with the spread of the virus.
Minister, you just said that it's been 3 months. The federal government takes care of more than 20% of health care. It's a shared responsibility, as you well know. And in this crisis, this federal government's had to step up. Are you actually telling me that the federal government does not have an accurate model of what your government is expecting right now on the coronavirus, the infection rates, and the possible fatalities 3 months into this crisis?
What I'm telling you is that every single actions that people are taking as of now will have an impact on that famous curve that we've been hearing for now more than 3 months. And so what we need is that people do the exact social distancing. And, you know, I commend Premier Ford for the fact that he wants to make sure that his population, people in Ontario, understand the importance of social distancing, because this is saving lives. And the Prime Minister has said it today. You know, the best way to deal with this is to make sure that people really, really comply with the very stringent measures. And so I'm in Montreal.
But
now.
Minister,
I've
heard that. But
right now, we know that this is an issue in my own city, and we know that cases are increasing by the day. But what we know also is that some people are still not, really taking care of the issue of social distancing. And that's an issue that Premier Legault has been really conveying. And so in that context, we need to make sure that at the end of the day, we work with people all across the country. We work with the premiers, with the provinces and territories. And yes, we will make sure that the data is that we take decisions based on data, of course.
Minister, respectfully, that was an answer to a question I didn't ask. I asked, why don't you have a model and why won't you reveal it? Today, Don Davies, the NDP health critic, said, quote, I'll quote him, "The federal government has a responsibility to be open with Canadians. We can't fight this virus blindly," he writes. "Without access to federal data, Canadians are being left in the dark on the potential duration, physical distancing measures, and our healthcare system's capacity to respond to the outbreak." You had British Columbia releasing data and forecasts on COVID-19 last week. And again, I ask you, people want to know how long they're going to be isolated. Does your healthcare system have enough arsenal to fight the virus? Again, with all due respect, what are you holding back these projections for? I frankly don't get it.
We need to make sure that we work with provinces and territories. And that's the answer to your question. And the Prime Minister is daily in front of his house presenting what we know as we know it now. And so we've talked about supply issues today. Every day we talk about different issues that we're dealing with, and we're taking decisions by the minute. I hear you regarding the importance of data, and of course, we will make sure to take all the decisions based on data.
But Minister, the question is, are we getting the right information? Let me give you an example, because in a crisis, trust is absolutely crucial. Today, the Canadian Medical Association, just a second, the Canadian Medical Association is calling out your government for a stunning lack of personal protective equipment. They took a poll, and I'm just going to read you what, this is the Canadian Medical Association. They said, it is a much starker picture on the state of supply at the front lines than what some of our political leaders have been sharing. 30% of physicians in community care believe they will run out of respirators and N95 masks, eye and face shields and goggles and glasses within 2 days or fewer, or if they run out. 71% of physicians in community care have tried to order supplies in the past month. Fewer than 15% have received confirmation that the supplies were en route. And in Nova Scotia, only 2% of physicians indicated that their order has been received. My point is, doctors are saying there's a disconnect between what your government is saying and what they are getting. What do you tell them?
I think that you talked about it, Evan, just before. Trust is extremely important right now. And we're taking decisions not only based on data, but also on what we're getting from the front lines. That information is coming through the provinces and territories. And to make sure to deal with the supply issue, we decided to work with all of them because we know that there's an international competition to buy supply, particularly in China. And more we're organized together to do bulk purchases, well, obviously the best we can work. And so my colleague, the Minister of Procurement, has made a point of working with all her counterparts, and we've been really making some important orders in China now.
But it's been late. My concern is it's been late. I'm going to read you from the CMA. This is a quote. Physicians in hospital settings are largely unaware of how long the current supply in their practice will last. Many respondents are being asked to ration supplies. The fact is your government was saying there's no shortage of supplies weeks ago. Now there is. Are you aware that there's a massive disconnect? And what will you do to fix that?
Well, we'll order more supply. And not only will we order more supply, we'll make sure that there's a Team Canada approach. Because 3 weeks ago, we decided to launch a new approach whereby companies such as Bauer, such as Irving Oil, such big companies all across Ontario would be able to change their operations to build ventilators, to make sure to have hand sanitizers, and basically to have that supply that is so fundamental to people all across the country. So we've been on this, and we're seeing great examples all across the country that basically workers are really making sure in different businesses to do that supply and send it all across the country. So I hear you.
Just last question, because I've got the Premier of Newfoundland Labrador standing by, Minister, and I really do appreciate you coming here. And I know these are tough questions in a crisis, but I think they're important. When the Prime Minister warned today that Canadians who will be repatriated, returning home, and I'll quote him, he said, pose a real risk, not just to their neighbors, but to their loved ones and to our entire economy. So he wants them to self-isolate. But if that's the case, people returning home, why did your government let so many flights come into Canada for so long and continue to do so? We were told closing the borders, I was told when I asked weeks ago, was not going to help. Now the opposite seems true. Question, going back to trust, was the information about closing the borders and people returning wrong before today?
We're taking decisions by the minute. This is an imperfect situation, and obviously we're doing the best we can in the circumstances. You're not perfect, I'm not perfect, nobody watching us is perfect. But what we know is that the spread of the virus is happening all across the world, and therefore more people are contaminated and can be contaminated around the world. And so people, Canadians coming back, obviously it's their home. You know, they have citizenship. The idea is to make sure that they can be safe here, but they have a duty. And that duty is to be in self-isolation for 14 days. And that's the best way they can make sure that we can contain the spread of the virus and we can make sure to save lives. This is a life and death decision where people are taking, and they should be bearing that in mind.
Minister Joly, I really appreciate you joining us. I know these are incredibly difficult times, and I appreciate you answering all those questions. That's Melanie Joly. I want to bring in now one of the